I'm asking question for 3 or 4 people. For prostate, what do you recommend if somebody has a prostate problem?
There are two issues here. One, just prostate problem. Another is prostate cancer and deeper chronic problems. There are two different protocols listed in the protocol for prostate as well as prostate cancer and deeper problems. It's not a serious issue. Actually, prostate problem can be easily cleared by people who are taking coffee, tea, and other so-called decoctions. And if you just change milk, caffeine, and sugar, within we have found hundreds of prostate problem people who had for 6 years. In fact, there was just a day before yesterday, I had a case in my clinic who was not able to hold urine for the last 15 years. His age was around 88, and they brought him, and he revisited us after 6 weeks. He is able to sleep through the night just by stopping milk, coffee, and tea. Within 3 weeks, you will see the result.
Wow, that's amazing.
Yeah, basically it is the caffeine and the milk which is troubling people. And the sad story is that most of these elders, when they are above 55, 60, they're difficult to change. I mean, they got used to certain things and they don't want to change. I mean, it's that is more difficult. It's not that prostate problem is difficult to heal. It is their mind set up. I mean, their setup of issues. I mean, they are all used to get up in the morning, have a cup of coffee, look at the newspaper, and they don't want to disturb their routines. And they have to have that much coffee only, otherwise they get really disturbed. I mean, we have seen this with 90% of these prostate cases, it is the mindset that is the bottleneck, nothing else actually.
I have a question.
Okay,
Question is related to the prostate. So, doctor, you just said, I mean, giving away coffee and tea, etc. But my friend here, he is sitting right here.
Hello. Namaste.
Yes, go ahead.
He is a vegan. He doesn't drink tea or coffee. He doesn't take sugar. But his prostate is enlarged. And what is your PSA?
20.5.
Yeah, sir, go ahead and use the protocol, the Ambali and the Kashayam's decoctions. Yeah, it's a matter of 6 weeks to 6 months. You should be fine. No, prostate is enlarged due to various reasons, but these are the ones which keep them active. So if you remove that, and healing process is very easily helped. And you do need millets to repair the damage that it has done. Yeah.
Yeah, I used the 5 kind of millet. So I used one kind every 2 days. So
Yes, one kind of millet every 2 days, and within a matter of 6 weeks to maybe 12 weeks, you should start feeling much better.
I've been using for about 2 months or 3 months. I've been using the millet for about 2 or 3 months already.
Yeah, do you have the decoctions with you? Yeah, it may take little more time. Please go ahead. You will be helped a lot. No problem. Yeah.
Okay.
Yeah, excellent.
Thank
So,
you.
Dr. Kader, I have question in related to that. My brother diagnosed with prostate cancer, and doctor
Yeah.
is asking for the radiation or removal of the prostate.
Yeah, that never do the radiation. If your doctor is good enough to remove the prostate, sometimes it may help, but doing radiation and chemo will complicate the system. So if it is too much enlarged, and then you can remove it surgically, that will not cause that much damage, and following the protocol will help them a lot. But then if they have enough time, I mean by 6 months to 1 year, then they can just follow the protocol of prostate cancer and be happy. But I would never suggest anyone to go through the chemo and radiation therapies, because they damage the system very badly, and the metastasis can occur much more faster with this kind of therapies.
It's intermediate level. his cancer is.
No, whether it is intermediate or fourth stage doesn't matter. It's a matter of time, 6 months to 1 year. Almost everyone gets better. That's not an issue here. But when you intervene with chemo, radio, and all kinds of bogus therapies, it becomes difficult for the system to manage this and that.
Thank you.